And good day everyone. Today I will be discussing about asthma. But first we need to understand first the part that is primarily being affected, and that is your bronchus. So this is the cross section of your bronchus, and we need to enlarge it, and that is the layer. Okay. And this layer consists of your mucus that is being secreted by your goblet cell. Okay, in this epithelium or lining of the bronchus, it consists of your pseudo-stratified epithelial cells. So under that uh, epithelium, you have the basement membrane. Okay, and the space between your basement membrane and your smooth muscle is what you call your lamina propria. Okay, inside the lamina propria are mast cell, your macrophages, eosinophils, and neutrophils. And after lamina propria is your smooth muscle, and under which is or are the glands. Okay, we need to define asthma. And this is a chronic inflammatory disease. So, inflammation usually ang asthma, no? Of the airways that causes airway hyperresponsiveness, mucosal edema, and mucus production. So, before we discuss the pathophysiology of asthma, we need to understand that there are two types of your asthma, your atopic or extrinsic and non-atopic or intrinsic asthma. When we say atopic or extrinsic asthma, these are generally associated with allergies, okay, which are the main cause of trigger. And your non-atopic or intrinsic asthma, these are the factors that comes within, okay, or this asthma is not allergenic. It means there is something inside the body of the patient that causes the problem. But we will be tackling more about the atopic extrinsic asthma since this is the most common form. So let's start with the triggers. Under your triggers are your allergens. Okay, your allergens has two types, seasonal and perennial. Pag sinabi mong seasonal, these are allergens that releases during certain period or certain seasons of the year. Ano yung mga example nito? Ito yung mga pollens from trees, pollens from weeds, di ba? Yung mga trees kasi may season kung kailan sila namumulaklak. Ganyan. Okay? And your perennial asthma, these are allergens that are present throughout the year. Like for example, your dust, your animal dunders. Pag may mga alaga kang animals or pets sa bahay. Okay? And those allergens may enter the bronchus, dun sa may airway. Mag-enter sila doon, and then in the lining, meron doon yung tinatawag nating dendritic cell. That allergen may become trapped. It will be trapped on the dendritic cell, and that dendritic cell will phagocytose. Ibig sabihin, it will eat up, digest, and break down the allergen, and it will be sent inside the lamina propria, yung space between the basement membrane and your smooth muscle. So, masasend inside, it will be sent inside, and then it will pick up, okay, or it will be presented to your Th2 cell, okay. Now, this T cell will process the antigen. Pag na-process ng antigen, it will releases interleukins. Merong actually tatlo yun, pero we will be focusing on the two, your interleukin 4 and your interleukin 5. Sa interleukin 4, this will act on the B cell. B cell, tapos it will be converted to your plasma cell. This plasma cell now will be responsible in the production of your IgE. Magiging increase ang production ng IgE or your immunoglobulin E. And this immunoglobulin E will bind to mast cells through the receptors of these mast cells. Okay? When it is bind, it will form yung tinatawag nating mast cell complex. Okay? So, mast cell complex. Tapos, there will be a sensitization, magsasensitize yun, and resulting to the releases of histamines and your leukotrienes. Okay? Ano yung function ng histamine? Paano siya nakakapag-cause ng asthma? Your histamine is responsible for the contraction of smooth muscle. So, yun, pag nag-contract, magna-narrow ang airway. So, yun, magkakaroon na ng wheezing, magkakaroon na ng dyspnea, okay, air trapping, mga ganun. Another function of your histamine is the stimulation of your goblet cell. Diba, yung sabi natin kanina that goblet cell will release mucus. Ngayon, kung na-stimulate ang goblet cells, anong gagawin niya? Maglalabas ng mucus. Ngayon, yung mucus na yon, haharang siya dun sa way ng air. So, yon, magiging narrowed na rin yung airway ng patient. Okay? In your leukotrienes, these leukotrienes will assist in the inflammation process leading to the inflammation of lung tissues. So, pag na-inflame ang lung tissues, magkakaroon na rin ng narrowed airway. Let's go back now to your interleukins 5. This interleukin 5 will stimulate the production of eosinophil in the bone marrow, and then it will be migrated to the lung. Okay, it will migrate to the lung and will assist in the inflammation process that causes damage to the lung tissue. Pag nagkaroon ng damage to the lung tissue, yan, magkakaroon ng increased inflammatory responses. Tapos, may stimulate yung lung tissues to produce mucus. Mag-i-increase ng mucus production. So, ayun, this is the pathophysiology of your asthma. So, yung mga hindi maintindihan, pwede nating ulitin pag nag-meet tayo. Okay? We have these predisposing factors as we have tackled in your pathophysiology. Diba? We have two types of your allergens, your seasonal and your perennial. So, ito na yung mga examples niya. Seasonal, grass tree and with pollens. Your perennial will be mold, dust, roaches, or animal dander. Okay? Now, these are the contributory factors of your asthma. We have airway irritants, yan, exercise, stress, or emotional upsets. Ito na yung mga nag-exacerbate ng condition, and some of the contributory factors here are for intrinsic asthma. Ayan, medications, we have two medication na nagko-contribute. Yan, isa ang aspirin and the other is your beta blockers. Your aspirin, some of the specialists nagsasabi na mostly asthmatic clients has hypersensitivity to aspirin, and another is your beta blocker, and of course your viral respiratory tract infections and your gastroenteritis gastroesophageal reflux disease. Your gastroesophageal reflux disease, ito yung backflow, no? Nagre-regurgitate kasi yung acid into the esophagus. So, yun yung nagiging contributory factor. Now, let's go to your signs and symptoms of asthma. Because of the narrowed airway, ito na yung magiging symptoms na makikita mo sa patient. You have your chest tightness, yan, wheezing. This wheezing sound may be heard first on expiration, pero as the case worsen or as the case become chronic, pwede mo na rin siyang marinig during inspiration. Hindi siya inspiration na yung inspiration mo sa buwan na yung love mo, ganun ha. Inhalation yon, okay? Expiration is exhalation and inspiration is inhalation. Okay? Next is dyspnea. This means difficulty of breathing. Next is cough. This is often occur at night or early in the morning. Often occur at night or early in the morning because of the hormonal changes na nangyayari, especially to the girls. Nag-i-increase kasi yung level ng hormones during these times. Okay? And because of the dyspnea and chest tightness, nagkakaroon ng restlessness si patient. Ayan. Pag nag-exacerbate na yung condition, magkakaroon na ng absent or diminished lung sounds kasi meron na siyang air trapping na nangyayari. Yan, yung hyperresonance, ganun. Kasi magkakaroon ng hyperinflation. Okay? Kaya meron siyang diminished lung sounds and hyperresonance. Si diminished lung sounds kasi nag-decrease na kasi yung airflow kay client. Kaya wala ka nang maririnig on the lungs. Use of accessory muscles during labored breathing. So, kailangan niya ng additional help from the accessory muscles. Okay? To keep niya with hyperventilation, ito na kasi nagko-compensate si patient. Kailangan niyang ilabas yung air na iiwan dun sa alveoli. Kaya, nagkakaroon na ng hyperventilation. And of course, with your pulmonary function, test will demonstrate decreased airflow rate. So, those are the signs and symptoms. So, ang pinaka-distinct na characteristic nito ay yung tinatawag nating wheezing sound. Pag naririnig na natin ang wheezing sound sa mga patient, may asthma. Okay? So, we have assessment and diagnostic findings. So, yan. During acute episodes, sputum and blood tests may disclose eosinophilia. So, yan. Eosinophilia, it means elevated levels of eosinophils. Diba dun sa pathophysiology natin kanina, sinabi natin na yung interleukin 5 will stimulate the production of eosinophils in the bone marrow. Another is serum levels of IgE. Diba? Dun sa pathophysiology natin, tumataas yung production ng IgE because of the plasma cells. Diba? Yan. And this indicates that there is, or serum levels of IgE may be elevated if allergy is present. Okay? ABG analysis and pulse oximetry, arterial blood gas analysis and pulse oximetry reveals hypoxemia during acute attacks. Yung mga early stages. Hypoxemia muna yan bago siya magkaroon ng during acute attacks, hypoxemia muna si client. Okay? And initially, hypocapnia and respiratory alkalosis are present. Hypocapnia, also termed as your hypocarbia or your low carbon dioxide in the blood. and respiratory alkalosis. These are due to hyperventilation. And pag nag-hyperventilate, a normal partial carbon dioxide in the partial pressure of carbon dioxide in the blood may be a signal of impending respiratory failure. Bakit? Because carbon dioxide is 20 times more diffusible than oxygen, and it is rare for partial pressure carbon dioxide to be normal or elevated in a person who is breathing very rapidly. With the complications, ito magkakaroon na ng complication si asthma pag hindi ito na address kaagad, and this includes your status asthmaticus, pneumonia, atelectasis, and respiratory failure. Status asthmaticus is because of the air that is being trapped in the alveoli because narrowed yung bronchi. Your pneumonia, these are the mucus productions that is being solidified. Hindi na na-control yung pagdami, tapos solidified pa siya. So, that's your pneumonia. Your atelectasis, since the alveoli, nag-hypovent na, hindi na siya makapag-work ng mabuti, magkakaroon ngayon ng lung collapse. And eventually, maglilid yan ng respiratory failure. And the worst, na ayaw naman nating mangyari is, of course, death. Medical management. So, immediate intervention is very necessary because the continuing and progressive dyspnea leads to increased anxiety and aggravating the condition. So, under your pharmacologic therapy, there are two general classes of your asthma medications. These are your long-acting medications and your quick relief medications. And your long-acting control medications consists of, number 1, corticosteroids. These corticosteroids, and nakikita ko sa mga patient to usually, are the most potent and effective anti-inflammatory medications. So, most potent, ibig sabihin, napaka-effective nito, no? So, dapat si client laging meron nito. Corticosteroids are corticosteroid drugs ends with son, night, and light. Yan. Beclomethasone, fluticasone, prednisone. Yung mga yan. Yung night naman, your budesonide, triamcinolone acetonide, ganun, and your flunisolide. Corticosteroids are broadly effective in alleviating symptoms, improving airway function, and decreasing peak flow variability. Initially, the inhaled form is used, pero yung spacer should be used with inhaled corticosteroids, and pag gumamit nito, kailangan mag-rinse ng mouth si client to prevent oral thrush. Okay? Yung mga medications pala under your pharmacologic therapy, the route of choice for administration is the MDI or your metered dose inhaler. Okay, ulitin ko, MDI, metered dose inhalers. Another is mast cell stabilizers. Di ba kasi dun sa pathophysiology, pag na-bind yung IgE dun sa may mast cell, tapos masensitize ito, magre-release siya ng histamine. So, dapat dun pa lang i-block mo na siya. I-stabilize mo na siya dun. So, kailangan gumamit ka na ng mga drugs sa may sodium. Yan, cromolyn sodium, nidocromyl sodium. Okay, now with your long-acting beta-adrenergic blockers. Okay, beta-adrenergic blockers, or yes, long-acting beta-adrenergic agents or agonist. Okay, we have yung mga, pag rinig mo na yung beta, isipin mo na yung mga drugs na nag-end na terol. Ayan, salmeterol, albuterol, formoterol. Okay? These long-acting beta-adrenergic agonists are used with anti-inflammatory medications to control asthma symptoms, and particularly those that occur during the night. Ayan. Next are your xanthine derivatives. Yung mga methyl xanthines na to. Your methyl xanthines are mild to moderate, or your xanthine derivatives are mild to moderate bronchodilators. Ano ba yung problem natin with asthma? It's bronchoconstriction or your narrowed airway. Okay? So your xanthine derivatives will dilate the bronchus, usually used to addition to inhaled corticosteroids. And it is mainly for relief of nighttime asthma. So pareho sila ni long-acting beta-adrenergic agonist, no? Nighttime, relief of nighttime asthma. With leukotriene modifiers, with xanthine derivatives pala, remember yung word, yung drug na nag-end ng phylline, yan, aminophylline, theophylline, parang xanthine, di ba? Aminophylline, theophylline, ganon. Na leukotriene modifiers, di ba? Yung isang problem natin doon na nag-assist in the inflammation process, your leukotrienes. These are the new class of medications, and these are potent, no? These are very effective for the bronchodilation. Okay? Leukotrienes inhibitors acts by either interfering with leukotriene or blocking the receptors. So, pag ano mo na, parang Lucas, Lucas, Zephyr Lucas, and Montelukast. Yan, yung mga leukotriene na yan. And the combination products are also used in asthma. You have your albuterol sulfate plus ipratropium bromide. Ang tawag mo doon ay Combivent. Tapos yung fluticasone propionate plus salmeterol inhalation powder. Now, these are your quick relief medications. So, these medications are medications of choice for relieving acute symptoms and preventing exercise-induced asthma. Your short-acting beta-adrenergic agents or agonist. Agonist yan. Okay? These are used, guys, in emergency situations. Yan. Acute attacks, sorry. They are used in acute attacks. And also, they are used in preventing exercise-induced asthma. So, pwede siyang maging prophylaxis. For example, kung gusto mong mag-exercise at may asthma ka, inom ka muna nito, tapos pwede nang mag-exercise. Anticholinergics may bring benefit in severe exacerbation, but they are used more frequently in COPD clients. Yan, ipratropium bromide or your Atrovent. Okay, your peak flow monitoring. This peak flow meters measures the highest airflow during forced expiration. And this equipment, guys, is used by blowing out hard and fast in a single blow. So, single lang yan, yung pinaka maximum na kaya nung patient. Yung tinatawag nilang personal best. Okay, the patient is instructed in a proper technique, tapos particularly to give maximal effort. Yun. And this is determined the personal best, yung sinasabi ko kanina na personal best is determined after monitoring peak flows for 2 to 3 weeks after receiving optimal asthma therapy. So, paano siya nag-grade? Kung makikita mo dyan, meron siyang colors. Ayan, merong green, yellow, and red. Yung green yung pinakamataas, that's 80% to 100%. Yan yung personal best. And yellow is 60 to 80. Your red is less than 60. Okay? And it indicates the current degree of asthma control. Now, let's have this nursing management. Okay? We need to monitor for the severity of symptoms so that it will not be worsened. Kasi pag yan hindi na treat kaagad, pag yan hindi na attend kaagad, maaring si patient ay maka-experience sa mga complications. Yun nga, yung status asthmaticus, your pneumonia, atelectasis, and respiratory failure. We need to obtain history of allergic reactions to medications before administering. Yung mga asthmatic client kasi natin, marami silang drugs na iniiwasan kasi they are allergic to it. Okay, nagiging hypersensitive sila sa mga drugs. So, dapat natatanong natin yon before giving the medication. Another kasi dyan, before tayo mag-administer medication, especially to asthmatic clients, lagi tayong i-skin test, lalo na pag antibiotic yung binibigay. Okay? And we need to monitor. Okay? We need to monitor the patient's response to that, to the medications that you are administering. Yun, administer medications that are prescribed, pero imo-monitor pa rin natin sila kasi hindi natin alam, baka magkaroon sila ng hypersensitivity dun sa drug. Okay, fluids may be administered if the patient is dehydrated. Paano ba siya nagkakaroon ng dehydration? Si client kasi ay nagkakaroon ng hyperventilation. So, due to hyperventilation, nag-i-increase ang kanyang, yung tinatawag nating insensible fluid losses. Isa pa is, pag naging restless and dyspneic na si client, nag-i-increase ng perspiration. So, and another is, pag si client hindi na matolerate yung oral fluid intake. Okay? Pag hindi na yan na-tolerate, mag-intravenous fluid na. And antibiotic agents may be prescribed if the patient has underlying respiratory infection. Diba, one of the trigger kasi is infection. Okay? And if worst comes to worst, and if the patient requires intubation, we need to assist, no? We need to assist the doctor in the intubation procedure. Okay, that's all for the asthma. I hope you understand the disease process, and if there's any clarification, please just leave a message. Thank you so much.